Hello everyone, I am a second year medical student in Nepal and today I'll be presenting on the topic management of COVID-19 in cancer patient. Firstly, I want to say that all the information in this presentation are derived from the research article till now. So now let's start our presentation. When a comorbid situation or comorbid case is presented, then we need to treat both the diseases. In this case, we need to treat COVID-19 as well as cancer. And there is a assumption that comorbid situation increases the severity and increases the mortality and morbidity rate. And just in this case, before there was a question whether cancer patients are more susceptible to COVID-19 infection or not, and what if they get infected by COVID-19. Then research found out that uh, as cancer patients have decreased immunity either due to cancer or due to the cancer directed therapy, it increases the risk of infection compared with the general population. And data from different hospitals have said that a patient with cancer who were admitted to the hospital with SARS-CoV-2 infection have a high case fatality rate with high rate observed in the patient with hematological malignancies than with solid tumors. But this case cannot be generalized to everyone. The risk for immunosuppression and susceptibility to SARS-CoV-2 infection, it varies between the cancer type, treatment administered, and the stage of therapy. So we discussed about the risk and severity. That's why FDA has recommended cancer patients for immunization against COVID-19 infection and infection under emergency authorization use. Regarding medication in COVID-19, right now FDA has approved remdesivir and corticosteroids, and many researchers have approved the use of remdesivir in cancer patients with the critical COVID-19 case or infection. Regarding corticosteroids, there are two theories. One theory says that in viral phase, we need to increase the immunity, so there is a need to decrease the viral load. That's why corticosteroids cannot be given as it is an immunosuppressant. But in inflammatory phase, since there is high inflammation and we need to suppress immunity, that's why corticosteroids is proves to be the best drug choice in this case. So this both theories contradict to each other, and researchers had the same question in the initial days. Then they conducted more and more researches, and finally they are with the fact that corticosteroids can be given to the cancer patients in the critically ill situation only, and that is if the situation is severe. And regarding cancer therapy, as we know that cancer patients are under different therapy, that is radiotherapy, chemotherapy, elective therapy. So the treatment of cancer, it should be continued or withhold if they get COVID-19 infection and have symptoms. So for this one, many researchers are conducting different research across the world, and for now, experts suggest that if the treatment has not been started, then reasonable duration of delay of greater than 3 months for cancer with low risk progression, 1 to 3 months for cancer with intermediate risk of progression, and no delay for cancer with high risk of progression. Uh, this case is for the cancer patient who have not started the treatment, and if they have started the treatment, then the clinical decisions should be individualized, consulting with the oncologist and the doctor team handling the COVID-19 infection. It should it varies according to the cancer type, treatment administered, stage of therapy, COVID-19 severity, cancer recurrence, progression, and patient's tolerance of treatment. And we discussed that cancer treatment, it can be resumed, or we can uphold the treatment according to the severity of COVID-19 infection and cancer types and grade. So what is the optimum time to uphold the treatment, and what is the optimum time when to resume the treatment and continue as normal? For this one also, there are many ongoing research across the world, but the optimum time duration between the withhold and the resumption, it's unclear, and it should again be consulted with the oncologist and the medical team who are handling the COVID-19 case according to the cancer type, the immunity of the patient, and the recovery from COVID-19 infection. Lastly, I want to say that all these facts are driven from the research articles till now, and this might differ tomorrow or in the coming future according to the different research papers ongoing in different part of the world. So I request everyone to keep updated with the research article. Thank you.